Elmhurst is an inspiring place, and it really deserves its status as a legendary institution. The people we take care of are the people who often have nowhere else to go.
What brought me to Elmhurst Hospital and why I've stayed here all these years is because I'm just so proud of being able to take care of these patients. They're so hardworking, and they're just trying to make their dreams happen here, and they often don't have resources to go to other hospitals.
There are places who will make a patient just well enough to be discharged so that somewhere else can take care of them. And we are the somewhere else. Sometimes they get off the plane and they just have a piece of paper in their hands that says Elmhurst Hospital, and they get in a cab and they end up at our doors, and we turn no one away. There's really no other place like this in the country. Our patients have really hard lives, and that makes taking care of them not the easiest job, but they're the most grateful patient population I have ever worked with.
I just find it's a wonderful place to work, given all the patients that we have here, this fascinating array of illnesses that we see, and we're providing a great service for people who are underserved. And I think the training and the learning that we can provide is just top-notch.
It's very unique in that it combines all the interesting things about working in a big city hospital with the feeling of actually being in a small community, what I might imagine it would be like working somewhere like outside of New York City. I really feel like we're a true part of this neighborhood and community, and that really brings about a great relationship with our patients. In clinic, I have patients now, that I've known for over 10 years now, and kind of really having that relationship with them and seeing how we're here as a part of their community is one of the really rewarding things.
Elmhurst Hospital Center is located in the most diverse zip code in the entire United States. The benefit of that is having exposure to a huge variety of cuisines, from Thai food to Mexican to Nepalese, Tibetan. We have it all here.
This is a busy area. It's a relatively safe area. If you just walk around the streets, you'll feel like you're going into different countries. So everybody brings their cultures in with them.
Often you'll be in the elevator and it seems like 5 continents are represented among the people who are next to you.
I don't think there's anywhere else where you can find such diversity among the staff and the patients.
We see a lot of pathology dealing with different types of autoimmune conditions as well as different types of infectious disease that you won't see anywhere else.
And I think it makes for an amazing environment, both in terms of the richness of the clinical pathology you will see, and the fact that you will make diagnoses that most people will just get to read about. You'll read case reports or you'll read Harrison's, but we see these cases every day and we make the diagnoses. Patients don't walk in here with a chart full of pre-diagnosed conditions.
You will see the most unusual cases, and you are going to make the diagnosis because they're coming into you. You are their doctor. As a PGY 1, 2, or 3, you are their doctor. They'll view you as their doctor, not the attending in the nice suit.
Residency truly is the most formative experience of your life. What you get out of residency will determine not only what kind of a physician you are, but really it'll affect every aspect of your life for the rest of your life. And you have world experts in their fields who are here for you, who are bedside rounding with you, who are giving you lectures, who are discussing cases with you in the hallways. I think this interaction paired with the fact that you're seeing literally every disease in the world, most things that people will only read about in textbooks or will read case reports about, we're seeing this every day. I think that combination of the clinical pathology and the faculty who are available and dedicated is what makes for amazing education.
Another thing that you'll get here at Elmhurst is a lot of autonomy. Our attendings really pay attention. They can tell how much you're able to handle, and they'll give you the room to develop as a physician in the way that you want to be.
I think there are a lot of places that say that they give their residents autonomy, and what they really mean is that they're letting their residents run around like cowboys. But we pair that autonomy with really close supervision. So we structure our inpatient rotations so that there's 24-hour in-house supervision by both hospitalists and critical care attendings. I think residents feel really supported. They know that they're never on their own.
We are here to teach you, but we're here to help you, and we also will let go. We'll know when to let go. One of the things that I often tell everyone is that here we are like an eagle. We have the eaglets, we put them to fly, they fly, and you know they don't fly right away. We let them, and we catch them before they fall until they learn how to fly on their own.
And not only are they exposed to every disease in the world, but they are also learning about it, and they are getting feedback on it. They are getting direct observation. And that is really what makes for a rich residency experience.
Our attending staff is here for a mission. The mission is to educate. We've hired a lot of new younger attendings. We have most of the big specialties here. We have a very tight Mount Sinai affiliation since the 1960s. Their residents come here, our residents are here. We have EM residents, we have psychiatry residents, we have our own fellowships in 3 areas, and we have ID and cardiology fellows from Mount Sinai. Everybody works together.
I've been here for 20 years. And I would say the thing I like the most about Elmhurst is the people that I work with. I think we have an exceptional collection of very dedicated physicians who come here mission driven and ready to make a difference in the world.
Here you actually know everybody. So if you're in clinic and you have a question and you want to talk to somebody from GI or cardiology, it's not like you're just referring to some stranger and waiting to get an opinion. You can call up an attending that you know. They'll pull up the CT scan of the lungs and look at it for you. For the patients, pretty much when they start to come to Elmhurst, they kind of stick here for all of their care with primary care as well as the specialist. So I feel like that's a really nice thing that it basically brings them a whole team of people that really know each other to work together to bring the best help for them.
One of the really special things about the program is the camaraderie among the residents here. It's a program that's big enough that you're going to find people who you have things in common with and who you get along really well with. But it's small enough that you get to know everyone else in the program. And that has really helped. Everyone is looking out for each other. Everyone has each other's back. And that was really obvious during the initial COVID surge last year. We really found that we were able to rely on each other, and we all came through for each other through that really challenging time.
The nurses, the technicians, the doctors, everyone came together, but the rest of the hospital, everyone came together as a whole and everyone helped out.
It's really an all for one and one for all feeling all around. And it applies to the attendings as well. I think the residents feel completely comfortable coming to them with a case or a personal problem, whatever it is. It really is one community that feels like a family.
You have a staff that's very compassionate, and we have a lot of camaraderie amongst the residents.
The unparalleled sense of clinical confidence you get, I don't think you get that anywhere else.
I have great colleagues, and it is so fun to practice medicine here. And I have wonderful residents.
The thing that's really telling about Elmhurst is that people who come to work here don't tend to leave. And I think that it's because the people who come to work here are really driven by the mission of the hospital. by the idea of taking care of the patients who really need us, and they find working here incredibly gratifying.
I've been here through since 9/11, since hurricanes, since blackouts, through COVID. I'll never leave here. I'll never leave here. There's nothing like this program.
When you walk into the place, you can really feel this spirit of the place, and everyone from the security guard to the CEO is driven by that mission. Come train with us. There's really no place like it.